Welcome to this explainer. Today, we're diving into something that literally sounds like it was ripped straight out of a sci-fi novel. I mean, imagine being told that after years, or maybe even decades of total blindness, your sight could actually be restored. But there's a wild catch. To fix your eye, the surgeons are going to need one of your teeth. I know, it sounds completely bizarre, but it's a miraculous reality for a very select group of patients.
So it really begs the question, right? How on earth can a tooth cure end-stage blindness? How do two completely distinct fields, dentistry and ophthalmology, merge to solve a problem that standard medicine is basically given up on? Well, we're going to explore the exact step-by-step mechanics of this procedure and look at the profound impact it has on the people who go through it.
Okay, so the formal medical term for this procedure is Osteo-Odonto-Keratoprosthesis, or OOKP for short. People often just call it tooth and eye surgery. It's an incredibly intricate, highly successful multi-stage procedure. Basically, it uses a patient's own tooth and the surrounding bone to mount an artificial cornea, which is an optical cylinder, right into the eye. It's an absolute interdisciplinary marvel requiring seamless coordination between oral surgeons, ophthalmologists, and prosthodontists.
Okay, let's dive into this. Our roadmap for today covers 1. The ultimate medical marvel. 2. Anatomy of a miracle. 3. Stage 1, the preparation. 4. Stage 2, the implantation. 5. An emotional roller coaster. And 6. The true impact of sight.
Section 1. The ultimate medical marvel. Usually, if someone's cornea is irreparably damaged, a standard corneal transplant is the go-to solution. But for patients who've suffered severe chemical burns to the face or maybe have rare autoimmune conditions like Stevens-Johnson syndrome, a regular transplant is basically guaranteed to fail. Their eyes are just too dry, heavily scarred, or keratinized, meaning the surface has become tough and skin-like. A standard synthetic artificial cornea would just be rejected and pushed out by the body. But OKP? It's different because it uses the patient's own living tissue. It creates this immune-privileged environment. It actually thrives in a hostile, dry environment where all other methods fail. For these patients, it's truly the last and best hope.
Section 2. Anatomy of a miracle.
And this brilliantly illustrates the foundation of the procedure. Surgeons literally harvest a healthy, single-rooted tooth from the patient, usually a canine, along with a portion of the surrounding jawbone and ligaments. Now, you might be wondering, why a tooth? Well, dentin is incredibly durable, and the surrounding bone integrates perfectly with the tissues of the eye. If the patient doesn't have a suitable tooth, an allograft from a donor can sometimes be used, but the patient's own tissue is always the gold standard to prevent any rejection.
So once they have that tooth, the crown is actually chopped off, and the root and bone are meticulously shaped into a tiny rectangular plate called a lamina. A hole is drilled right through the center of the dentin, and a polymethyl methacrylate, or PMA, plastic optical cylinder is cemented into place. This cylinder is going to act as the brand new visual axis, channeling light perfectly to the retina. It's a literal fusion of human bone, tooth dentin, and advanced optical plastic. Pretty wild, right?
Section 3, Stage 1, the preparation.
Now you should know, this isn't some quick afternoon procedure. It's a multi-stage marathon. Step by step, Stage 1 is all about meticulous preparation. First, the eye is opened up and all that keratinized scar tissue and diseased corneal surface are completely stripped away. Second, tissue from the inner mucosal lining of the patient's cheek is harvested and grafted right onto this newly cleaned surface of the eye. This cheek tissue is amazing because it withstands dry environments beautifully. Simultaneously, the tooth bone complex is harvested and fashioned into that lamina we just talked about. But wait for it, it doesn't go into the eye yet. In a totally fascinating step, this tooth plastic complex is actually implanted into a subcutaneous pouch, usually under the skin of the patient's cheek or abdomen. It stays there for 2 to 4 months just to grow a brand new network of blood vessels.
After a few months of healing, the eye is successfully covered by that cheek lining graft. Notice how it looks completely pink? There's literally no visible eye at this stage, which can actually temporarily reduce a patient's light perception even further. But this healthy, vascularized mucosa is absolutely essential. It's going to support and nourish the tooth implant that's about to arrive.
Section 4. Stage 2. The implantation.
So the crucial point is what happens in Stage 2, about 2 to 4 months later, once everything from Stage 1 has fully healed and the tooth complex has its own blood supply. First, the surgeons retrieve that vascularized tooth lamina from the patient's cheek pouch. Next, they open up that mucosal graft on the eye. They remove the center of the patient's damaged cornea, and they completely remove the iris and the lens behind it to clear the visual pathway. Then the tooth lamina is finally implanted into the eye, with the plastic cylinder sitting right in that corneal hole. Finally, they suture the cheek mucosa back over the whole complex, creating just a tiny central opening large enough for the plastic cylinder to poke through. Light can now pass unimpeded through the cylinder directly to the retina.
Section 5. An emotional roller coaster.
Now, what's really interesting about this is that the physical mechanics are only half the story. Clinical psychologist Dr. Angela Busuttil highlights that patients face an intense emotional roller coaster. I mean, going from decades of darkness to suddenly seeing the faces of your loved ones again, it's euphoric. But the psychological weight is massive. Patients often face anxiety about their changed appearance, having a pink eye with a plastic cylinder in the center. And there's this constant looming fear of whether this newfound sight will stick around or suddenly vanish again.
And man, the physical demands are just as grueling. After the final surgery, patients literally have to lie strictly face up for about a week to make sure the seal holds and to prevent any catastrophic complications. Plus, this is a lifelong commitment. We're talking endless specialist follow-ups to monitor for serious risks, like the bone resorbing away, the device pushing itself out, or the onset of secondary glaucoma, which actually happens in a significant number of cases.
Section 6. The true impact of sight.
So, despite all that pain, the weeks of staring at the ceiling, and the lifelong checkups, is it worth it? Well, the data gives us a resounding yes. A specific study adapting the Visual Function Questionnaire for OOKP patients found that a staggering 80% of patients reported a significant improvement in their overall quality of life. This goes way beyond just reading an eye chart. This is about getting your independence back, seeing the world, and re-engaging with society after years of total isolation. The satisfaction rates are incredibly high because, frankly, the alternative is complete darkness.
And what's truly mind-blowing here is just how durable the patient's own tooth actually is. Studies tracking patients long-term show an 85% anatomical retention rate for up to 18 years, and some retrospective studies even show success maintaining the implants for up to 30 years. This basically proves that the living tooth bone complex is uniquely resilient, fighting off infection and rejection in a way that purely synthetic materials just can't match over the decades.
Functionally, the results are absolutely life-altering. Patients who only had light perception before the surgery often achieve visual acuity of 2200, which is highly functional vision. And get this, if the retina and optic nerve are completely healthy behind that damaged cornea, a lot of patients actually achieve 20/20 vision right through that tiny plastic cylinder. Sure, their peripheral vision is restricted because it's kind of like looking through a narrow tube, but the central clarity, it is flawless.
It honestly just leaves you in complete awe of the human body and the sheer ingenuity of medical science. By literally borrowing a piece of bone and a tooth from the mouth, surgeons can rebuild a window for the eye. It is the ultimate testament to interdisciplinary medicine. And it leaves us with one final thought. If a tooth can literally cure blindness, what other boundaries of the human body is medical science poised to conquer next? Thank you so much for exploring this marvel with me.